Vitamin B6, though best known for its role in amino acid metabolism and neurotransmitter synthesis, also acts as a subtle yet powerful anti-inflammatory agent, a fact that has gone largely unnoticed in mainstream medicine and nutrition. Research shows that B6 levels inversely correlate with markers of systemic inflammation, such as C-reactive protein, CRP, and interleukin 6, IL-6. In other words, as B6 levels drop, inflammation tends to rise. This relationship suggests that B6 isn't just passively affected by inflammation, it plays an active role in modulating it. Still, despite these findings, most inflammation-related studies and protocols continue to focus on omega-3 fatty acids, curcumin, or vitamin D, while B6 remains almost entirely excluded from the conversation. The link between B6 and inflammation hinges on its coenzyme form, pyridoxal 5-phosphate (PLP), which participates in hundreds of metabolic reactions, including those that regulate homocysteine levels and oxidative stress responses. Homocysteine, a sulfur-containing amino acid, is known to be pro-inflammatory and toxic to blood vessels when elevated. B6 helps convert homocysteine into cystathionine, a harmless intermediate that can be used to generate glutathione, the body's most important antioxidant. In this way, B6 acts both upstream and downstream in pathways that influence inflammation and cellular defense. A deficiency in B6 leads to elevated homocysteine, increased oxidative damage, and a more inflammatory internal environment. Chronic low-grade inflammation underpins many of the most common diseases today: atherosclerosis, rheumatoid arthritis, diabetes, neurodegenerative disorders, and even depression. In all of these, B6 could play a protective role, yet it is rarely acknowledged. For instance, in cardiovascular disease, elevated CRP and homocysteine are independent risk factors for arterial damage and plaque buildup. While folate and B12 are often recommended to manage homocysteine, B6 is just as essential to completing the methylation and transsulfuration cycles that keep it under control. Inflammation reduction with B6 is not as immediate or dramatic as with pharmacologic agents like NSAIDs or corticosteroids, but it operates at a more fundamental level, by correcting underlying imbalances that generate inflammation in the first place. In autoimmune and inflammatory conditions like rheumatoid arthritis, patients often show signs of B6 depletion, not merely from dietary insufficiency, but due to increased metabolic turnover. Inflammation itself consumes more B6 as the body ramps up cytokine production and protein metabolism. This creates a vicious cycle. Inflammation depletes B6, and low B6 allows inflammation to persist unchecked. Yet despite this, anti-inflammatory strategies rarely include targeted B6 repletion, even though some clinical trials suggest supplementation could lower CRP levels and improve inflammatory balance when added to standard treatment regimens. Another critical angle is oxidative stress, which fuels and sustains inflammation. B6 indirectly supports the body's antioxidant defenses by aiding in the synthesis of glutathione precursors. Without enough B6, the generation of glutathione slows, and the cell's ability to neutralize free radicals is impaired. Over time, this leads to cumulative tissue damage and perpetuates inflammatory signaling. The body becomes stuck in a pro-inflammatory state, not due to infection or trauma, but because the tools needed to restore balance are lacking. B6 is one of those tools, quietly essential for restoring redox balance and preventing inflammatory flare-ups from becoming chronic. What's remarkable is how little B6 is needed to perform these functions, just a few milligrams per day in most healthy adults. Yet, subclinical deficiency is surprisingly common, especially in older adults, individuals with inflammatory diseases, and people on long-term medications such as corticosteroids, antiepileptics, or even NSAIDs, all of which interfere with B6 metabolism. Because B6 is water-soluble and cannot be stored in large quantities, even short-term stressors or illness can quickly deplete levels below optimal, tipping the scales toward inflammation. Despite this, inflammation research tends to focus on newer or trendier interventions, often overlooking the foundational role of micronutrients like B6. This bias toward novelty may obscure simple, safe, and effective tools that could benefit patients at a much earlier stage in disease progression. Instead of only managing inflammation once it has caused structural damage, restoring B6 status could serve as a preventive buffer, an internal brake that slows or stops the inflammatory cascade before it becomes pathological. In the end, B6 is not a dramatic anti-inflammatory in the way that pharmaceutical drugs are, but it is a foundational regulator, essential to the body's capacity to control inflammation at the cellular level. Its depletion not only reflects underlying inflammation but actively contributes to it, creating a self-perpetuating loop of immune dysregulation. Reintroducing B6 into the broader conversation on inflammation is not about promoting it as a cure-all, but about restoring the biological terrain that allows the immune system to return to equilibrium. In this way, B6 is not just a supporting player, but a necessary partner in the quiet fight against chronic inflammation and the diseases it drives.